Hey guys, what's up? It's your girl Divinely Original or Darshell or whatever you want to call me, doesn't matter. Um I hope you all enjoyed your Martin Luther King holiday observance and honor him in whatever way you normally do or whatever. Even if it was just like just a free day for you and you didn't do any marches or any programs, whatever. I'm sorry, I'm just looking at my lips like they look really like shiny. I just put a little bit of Carmex on. That's why I don't like Carmex. My mom had the strawberry Carmex, and me being the person I am, I was like, I want to try this, even though I know I hate Carmex. So now, my freaking lips are tingling, and it looks like I have freaking lip gloss on or something. And it's chapstick. Whatever. Anyways, I digress. So needless to say, school started. Obviously, because I'm in my clinical uniform, I just got off about about an hour ago, whatever. Well, my hair looked like lumpy and bumpy, but I just put in some plaits or whatever. For those wondering why my hair looks like that, because I will be wondering why does her hair look like that. I'm sorry, I'm kind of hyped right now. Like I had 3 hours of sleep last night, but somehow I'm just like wide awake, so I'm assuming that around 9-10ish I'm gonna crash, but I have to wash clothes because I need to wash both my clinical uniforms. Whatever. Anyways, I'm rambling. Clearly, it's what I do. Whatever. We all know this if you've been a subscriber since the beginning. You know what it is. So now I'm just gonna kind of jump into the video, and I'm gonna try to give you like 1 or 2 tips for each course. Peds, I took a year ago. I took Peds last spring. Yeah, last spring. I actually enrolled in Peds and OB, but I ended up dropping OB because it was just too much or whatever. But I'll let you know about that in a couple minutes when I talk about OB. For Peds, our class, like our teacher doesn't really teach. It's kind of like a self-taught class, and I don't know. I guess I got used to somebody actually saying this is important and this is how this works and all that or whatever. Because I totally bombed the first 2 tests. Like I got like legitimately high F's. Like one of them was like a D, I'm not gonna lie, but the other one was like in the 60s. Like it was bad. But I went to talk to the teacher, and one of my clinical instructors was the other adjunct professor. So between talking to them and then burying my freaking head in the books, I kind of just pulled it together, and I was able to get out of that class successfully. In this class, this is kind of the class, like, it's after the first level med-surg and fundamentals. So this is when your teacher kind of starts letting you go on your own. She can't completely give you, that, I guess, autonomy, or that she can't let you be as free as she would like, because you're dealing with pediatric patients, and we all know that even though they're resilient, you can hurt a child, and their parents will be very upset with you. For peds in my clinicals, that's really all that happened with lecture. Like whatever. For my clinical, I had this really, really, really good nurse that I was paired with or whatever. Like my teacher would pair us with patients. She'd go look over the patients, see who would be the best patients for us to have so we can learn from them, and not necessarily the easiest, I will say that. And we kind of work with that nurse, and we started out with 1 patient, but then we ended the semester by having 2 patients, all getting us ready for the following semester, which is senior level med-surg 2 and 3, where some people will be having like 4 or 5 patients, which is crazy. Like, do I have to do 5 care plans? I'm just saying. Just saying. Asking an obvious question. Anyways, so my first patient was a very interesting patient. I cannot remember what that little girl had. I swear to God, for the life of me. Something was wrong with her mouth, where basically acids would really like mess with her stomach, and she'd get ulcers in her mouth, And I can't think of, something else was wrong. Something was wrong with her urinary tract system. I'm about to say urinary tract infection. But something was wrong with her urinary tract, so but I was with a nurse and she was trying to figure out, well, why are you taking this medicine or whatever? And I'm like, oh, she has the urinary problem. Whatever the urinary problem was, it was that medicine. Like, everybody knows medicine because that just goes with the GU system. Whatever, I digress. I'm gonna let it go because I'm not gonna remember. I'll probably look it up whenever we do GU in a couple weeks or something. Anyways, it was a bilingual family, and this time in clinicals is when I realized I was so happy that I'd taken that medical Spanish for medical professionals course. Like, I got to use that stuff. I spoke Spanish to the people because they were Latinas, and the only thing about those patients is the mom was really, really, really anxious and really, really ready to go. I don't know if she was pressured from the dad or she just didn't want to be in the hospital, which, who does want to be in the hospital? Even people who get paid to be in the hospital don't want to be in the hospital like that. But whatever, I digress. But so we were like, she has to eat her breakfast and she has to eat her lunch because basically she'd come in and she hadn't been wanting to eat because it would hurt her. So she was, at this point, she was like, she needed to eat. So we walk in because we're about to discharge her and the mom's eating her food. So needless to say, we had to wait till the next meal so she could actually eat the meal or whatever, and we can see her finish it and stuff like that. Because, you want to be friendly but firm with your patients or whatever in peds. That's one of the major tips. You have to be friendly but firm in peds, because the mom is always going to want you to do something that's not going to hurt the child, or she's going to be scared and anxious and all of this or whatever. You have to be friendly but firm and let her know this is how it is, this is what it is. But you don't overstep your boundary and be like, you do this, you do that, you do the other or whatever. You have to be like, well, I'm putting the bed, I have to put the bed low, even though it might hurt your back to bend over, because it's going to be safer for your 5-year-old to get out of the bed that way and it won't hurt themselves, as opposed to, you better keep the bed low because your child's head is going to be bust open if not. How would you respond? Would you respond defensively? I know I would. I'd be like, she must not know who I am. No, I'm just kidding. But in peds, my drug book was like my best friend. Like, I literally would have my drug book, which is a Saunders book. I think it's from 2011 or something. Purple, whatever. Purple's my favorite color, so I hadn't got a new one. So yeah, it's pretty petty, but it's fine. But anyways, so I literally would be carrying that book like around, because my teacher would be like, okay, it's 8 o'clock, it's 12 o'clock, it's 1 o'clock, time to give your meds, 9 o'clock, whatever, it's time to give your meds. You need to tell me what's the drug, what's the class, what's the major side effects of the drug, what's the dosage, what's the normal dosage, what's the pediatric dosage, and what's the safe dose range. So, and if you didn't have any, like, she would send you away. You would have probably 15-20 minutes to come up with answers for not just that medication, but all the medications, including PRN medications. And we all know everybody got 1,002 PRN medications that they don't take on a regular schedule. You're not about to give them. So what does it matter that I know this? Now, if I was on my own personal time and I didn't have to, present this to you, that would be totally different. But whatever, I digress. So my recommendation for peds is definitely have a drug book. Like, you need legitimately a drug book, or you can do the drug course. That's always easy too. Also, on this rotation, I had a patient. My first the first patient with a gastro-urinary problem. She I kind of just followed the nurse. I didn't really get involved. I kind of, just kind of helped a bit. But then my second patient was this baby, and I want to say he's about 6 or 7 months or whatever. He had an abscess on his near his groin. Well, they had to do surgery to obviously, to get it out and clean it up, and so he wouldn't have an infection or whatever. He spiked the fever a bit. They ordered some, I want to say, Tylenol, and we gave him that. He was fine. He was playing and laughing or whatever, so he worked out perfectly. And another one of my patients was a patient who had appendicitis and had an appendectomy because his appendicitis site had ruptured. His appendix ruptured. And yeah, which is basically a risk because who wants colon in their pleural? You know what? I'm not even about to get into all that. Y'all know what I'm talking about. Anyways, so with him, like it's not funny, but it's funny. So he's sitting and his mom's like, you want to get up? You want to move around? And of course he's in pain because he has this cut because, they do the, oh my God, is it laparoscopy? Is it endoscopy? I don't know. I can't even think of the word. Like, I don't even know at this point. My mind is gone. Whatever. Anyways, I digress. Basically, because he has those cuts from them going in with a scope or whatever and maneuvering through his body to see like what happened and do the surgical repairs and all of that or whatever, he's hurting. But he's been in the bed for I think a day and a half, 2 days or so or whatever. So his mom is like, you're getting out of the bed like right now, 2 days. So he's like, ah. So he starts walking around because his mom makes him and he's whining and he's like 12, 13 years old. He's whining. So then he goes and he sits. It's not funny. I swear to God, it's not funny. But it's like the funniest thing like to me. So he's in the bed and he walks to the door and back to the bed, and then he walks from the bed to the chair, which is next to the bed. And the nurse is like, okay, I'll help you sit. So he goes to sit, and then he's like, dude. And like, I don't know, just his face, like, it was hilarious to me. I was like, I know I can't laugh in here, but I kind of smirked. I was like, like, just see me laughing. But it was, I don't know, that was just a little funny or whatever. Not that he was in pain, but that he was being so dramatic about it. So yeah. With him, I got to empty his JP drain because they had inserted a JP drain, which if you don't know, it's a Jackson Pratt drain or whatever. It's kind of reminiscent of a grenade. And what they do is, it's like a bottle, like, those juice containers that have the little aluminum foil thing that you just peel back and you drink out of it. It's kind of like that. Like, you squeeze it or whatever, and then whenever you squeeze it, whatever's there, it'll suction out. It'll suck out. So that's pretty much how it works or whatever. So yeah. For my final, not really. I did really good on my final actually, and I had some bonus points. So yeah. This is in Peds. It's med surge on a little person essentially. So pretty much it's the same systems working the same way. You just have to watch out for them. The ranges, the dosages, the normal ranges, for the pediatric patient. That's pretty much it. And I'm gonna, since it's been like 15 minutes, I'm gonna close this video out because I think I've been like all over this video, legitimately, like, and I'm probably not gonna edit it because I'm not feeling like I want to edit a video. So yeah. I'm about to go do a whole bunch of dosage problems, probably like at least 150 because I have a dosage exam tomorrow and I haven't studied for it or anything. Not that I ever do. So I'm just gonna go and cram until probably around 7:45, which is 6:36 now. And yeah. with that said, happy studying, peace, and blessings.